severe storm alerts. Download the Local 3 weather app now.
If you took a poll around the Tennessee Valley, no doubt I think all of us would say it's the best place to live, and we're proud to call it home. And one of those reasons is because it's a very healthy place to live. It's beautiful. Things are always advancing here. So we're going to brag a little bit on the health side of things for our next guest, because he hates to be the one to brag. Dr. Rob Headrick is here. He's a thoracic surgeon with CHI Memorial Chest and Lung Cancer Center, and the brag is a congratulations, and then we'll kind of get into the meat of the conversation. But y'all were just recognized with one of the highest honors you can get in terms of thoracic surgery.
Well, I'd say coming back to my hometown is probably one of the most challenging but yet honorable things that anybody can do, particularly when you can help your own community. Healthcare is important to our happiness, to our families, to our stability in the community, so it's important to get good health care locally. Lung cancer is a big part that impacts our community, so our goal was to, one, try to improve the survival of lung cancer, and part of that is the treatment that you go through. We always say we don't want to make the treatment worse than the disease itself. So we've really followed the Mayo Clinic model where I trained in trying to adopt a team-based approach that gives us the best chance at getting the best outcome for our patients.
Well, it's working. So with this recognition that you got, we're in the top 6% of the country.
So we've been consistently ranking, and it's data where every patient that gets operated on, there's a lot of data, probably 30 pages of data that is collected, followed for months, and then submitted. And your benchmarks against all the big programs, so the Mayo Clinics, the MD Andersons, everybody. And you're ranked based on your outcome with how you're doing with lung surgery. Gives us a way internally of how to promote improvements, what things somebody needs to work on, how you're doing. And the great thing for our Chattanooga community is we've been ranked in the top 6% in outcomes for lung surgery in the community, in the nation. But what that really means, bigger than bragging on anything else, is that people don't have to go out of town for good care.
Well, you know, I'm from Atlanta originally, okay, and my family is still down there. And I've had some experiences the last several years with family who've had some health issues. And I'm not making this up, I've brought them to Chattanooga, and that's where they found their help.
Yes.
But we're just this little pocket that surprises people sometimes, but we are very much our community focused. This is your hometown, so why not bring the best here?
Well, we have a lot of great physicians, we have a lot of great people, and what's even more exciting, a lot of people like myself that grew up here, who are coming back here.
Right.
And there's nothing better than to be able to, for the people who helped us when we were growing up, maybe support us through our journey, to be able to come back and give back to our community, and one way is to make sure everybody's getting great health care.
Well, let's talk then about, for those people watching right now who are thinking, okay, great, because I know somebody who was recently diagnosed, or I'm going in for a screening of my own. Screenings are key, because if you catch it early, you can share the success rate now versus what used to be.
Right, so the biggest secret to lung cancer is to find it early. It has no symptoms, so lung screening, if you're over the age of 50, had a previous history of tobacco use, family history of any kind of cancer, you're certainly at higher risk. Females are at higher risk more than males. There's a genetic driver to this malignancy, to this type of cancer. Our second component, which is what we've been working on, is for those who get diagnosed with cancer, it's incredibly frightening. It shouldn't be painful. It's either a one-day surgery, 4 days of radiation, with your family disruptions minimal, your out-of-pocket expenses should be minimal. You know, the trips back to the doctor, back and forth, all of the nights of wondering of what's going to happen. Our goal is simply to not disrupt life. Get the cancer out, get the cancer treated, give somebody the best chance at a cure, which is what they want, but do it in the way that disrupts the family the least. And when we can deliver the lowest mortality and the shortest length of stay and the least pain and the least misery to that process,
right,
it just helps. It's part of the disease that we can impact.
Did I hear you correctly? It used to be that caught early there was a 20% survival rate, and now there's 90%?
Well, if somebody walks into a hospital or my office with symptoms from lung cancer, it's usually too late. If we go out and proactively get screening through their mobile program or through an imaging center, and it's caught early when they have no symptoms, then our 5 and 10-year survivals are approaching 90%.
Okay, so that has been something that I know you personally pushed, and I believe that I'm right with the mobile unit. You really designed it, like you traveled the country and designed it. So if people want to bring the mobile unit to their church or their school or their business, can they do that?
Absolutely. 495 Lung. You know, healthcare, nobody enjoys going for healthcare, myself included. So in this mission, if we can find lung cancer early, our odds are great at curing it. If we can make healthcare simple, bring the technology to the people, to their church, their business, who's not a fan of that?
Right.
And if you happen to have lung cancer, we want to make it simple. We want to make the treatment easy, get back to life. That's what everybody wants, and make it easy. And that's what we're proud about. The team that's been put together following the Mayo Clinic model is giving people the security and the confidence they don't have to leave town to get great care.
And by the way, you won't say this, so I'll say it for you. I believe it's the 6th time that y'all have received this very same ranking. So this is not a new status for them. You've gotten pretty comfortable on that pedestal.
This is great for Chattanooga.
Yes, it is. And we're glad that you did not become an astronaut, which was your high school dream.
That was my first start.
Thank you for becoming a thoracic surgeon instead. So if this benefits you, if you want to get in touch with them about having the mobile unit come your way, that would be fantastic. If you are needing to find some care, they would love to be the one to help you. So mylungcare.org is their website. 495-LUNG is the number you call, 5864 to schedule that appointment, right, to have the mobile unit come to you?
Yes, be happy to come to you.
Dr. Rob Headrick, thank you so much.
Thank you.
Your time is important. Local 3 News Today has